Hey everyone, Dr. Adam Hughes here again with ColumbiaThyroidRelief.com, and today we're going to be talking about thyroid success secret number 12. And this one is all about brain function. Now, what does your brain have to do with your thyroid? Well, everything. There's nothing that happens in your body without this up here working like it's supposed to be. But it's probably one of the most overlooked aspects of people's health or their problems or disease. If your brain and certain pathways in your brain aren't firing information, if they're not working like they're supposed to be doing, then that's going to have a huge effect on the rest of your body, your thyroid especially. As we've talked about before, your brain needs a few key things to survive, thrive, and function like it's supposed to. Fuel and activation. Well, let's talk about this activation, especially since your brain needs a lot of oxygen in order to be activated. That's one of the reasons why we pay so close attention to things like anemias and even oxygen deprivation. You know, people have problems with their sleeping and things like that. You have to pay attention to that, because if your body's and your brain isn't getting enough oxygen, then you can't make the fuel in order to activate pathways in your brain. So that's one of the reasons why, like I said, we check for anemias, we check for deprivation of oxygen, and we utilize exercise with oxygen therapy with a lot of our thyroid patients, just to add some added stimulus and activation to the brain, utilizing some extra oxygen in your system. Now, from another standpoint, you can also look at the brain from pathways according to certain neurotransmitters, which are little chemical messengers that your brain uses to talk and communicate with itself and the rest of your body. One of the main neurotransmitters that your thyroid works with and really needs is a neurotransmitter called serotonin. And of course, serotonin also has a huge effect on people's moods, their anxieties, and things like that as well. You know, whether or not they feel good, they feel happy. Serotonin plays a big role in that. But as we've talked about before, serotonin will have a huge impact on your thyroid physiology and your thyroid's ability to make thyroid hormones. Serotonin is also heavily influenced by something we've also talked about, which is your blood sugars. Imbalances in your blood sugars will alter how your body can make serotonin. And if it can't make the serotonin, then the serotonin can't have the good effects on your thyroid, and then you develop more thyroid dysfunction. So taking a step back and looking at both how the brain is actually firing its pathways, you know, between different lobes, between your thyroid, between the rest of the body, looking at those pathways and looking at things like neurotransmitter dysfunctions or blood sugar imbalances, anemias, all these things that will affect the brain. That's how you have to come to a conclusion. Is the brain involved, and what can we do to fix it? As I said, this is something that most doctors and therapists just don't pay any attention to. But if your brain isn't firing information like it's supposed to, how is anything going to work? So that's a question I'm going to leave you with. I hope this makes somewhat sense to you. As again, if you have any questions, feel free to call our office, and we'll see you next time.